Have you ever wondered how to support your patients with limited English proficiency? Find out how by utilizing the following 5 tips and learning how you can start advocating for your patients today. Did you know 1 in 5 Americans speaks a language other than English at home? The most common non-English languages in the U.S. are Spanish, Mandarin, Vietnamese, Arabic, and Tagalog. Patients who speak these languages will seek medical care, whether for routine checkups or emergencies. As a healthcare provider, understanding the prevalent languages in your community is essential to providing effective, culturally sensitive care. Does your organization include a section in the patient chart for preferred language? If so, be sure to use this feature to tailor your communication and enhance efficiency. If not, advocate for its inclusion. This valuable detail can significantly improve patient care and satisfaction. There are several interpreter modalities available to ensure patient safety. Know the interpreter options your organization offers. It could be in-person, ideal for complex cases, captures both verbal and nonverbal cues. Telephonic, quick and accessible and available 24/7 for most languages. Video remote, combines real-time video and audio with 24/7 access. Ad hoc, untrained interpreters such as family, staff, or children. This poses risks of inaccuracy, privacy breaches, and omissions. Use only as a last resort. Choose the right modality to prioritize safety and effective care. Communication techniques. Use short sentences and pause for interpreter translation. Speak in plain language. Confirm understanding with teachback or repetition in a shame-free environment. Focus on key points for discharge. Highlight instructions in the patient's preferred language and use visuals. Be mindful of limited health literacy and language proficiency. Make eye contact when reviewing materials. These techniques promote clear, respectful communication and enhance understanding. Recognizing and addressing miscommunication. Don't assume patients understand you. Head nods do not always mean comprehension. In some cultures, patients with limited English proficiency may nod or agree out of respect and not because they understand you. Ask patients to repeat or demonstrate instructions. Read body language and use critical thinking. Missed appointments, incomplete labs, or lack of improvement may signal lack of comprehension with their plan of care. Use an interpreter if unsure and simplify your language. Clear communication ensures better care and outcomes. Patient safety should always come first. Barriers to interpreter use, such as lack of time, reliance on limited bilingual skills, ad hoc interpreters, and weak policy enforcement, must not compromise care. Ethical practice ensures patients with limited English proficiency understand informed consent, admissions, discharges, and high-risk discussions. Use interpreters to bridge the gap in patient-provider communication. Investing time in proper communication ensures safer outcomes and builds trust among patients. Not every facility is well equipped, but work with what you have. Be aware that failing to utilize interpreters can lead to serious consequences, including adverse medical outcomes, unnecessary treatments, increased readmission rates, violations of the Civil Rights Act of 1964, which requires healthcare entities receiving federal funds, like Medicaid, to provide language resources for patients with limited English proficiency. In the era of value-based care, a lack of mutual understanding between patients and providers can also decrease patient satisfaction. Different languages bring different cultures. Familiarize yourself with those prevalent in your area to better understand how to interact respectfully and effectively. At the core, we share more similarities than differences. As healthcare professionals, advocating for patients is our shared responsibility. Let's commit to supporting patients from all backgrounds and language preferences. The tools are available. Sometimes they're as simple as addressing our own biases. Under Section 1557 of the Affordable Care Act, Healthcare facilities receiving federal funding must post taglines in the top 15 non-English languages spoken in their state. These taglines inform patients that free language assistance is available. Check if your facility has taglines posted. As patient advocates, speak up if improvements can be made to reduce language barriers. Remember, as Gandhi said, be the change you wish to see in the world. Thank you for your time. Please complete the module by proceeding to the post-module survey.